Hi guys, I had case 9. She's Mrs. VA and she's a 30-year-old female. She currently was admitted to the ER. She complains of chest pain for the past 90 minutes. On a scale of 1 to 10, she said her pain is an 8. She has sharp and constant right-sided chest pain as well as right-sided mid-back pain. And she said the pain seems to worsen as she lies down or takes deep breaths. And it seems to improve when she sits down. She also complains of difficulty breathing, and currently she denies any fever, chills, or coughing up of blood. She just returned home 36 hours ago following a 13-hour flight from Tokyo. Patient currently suffers from migraines since she was 23, has mild endometriosis for 5 years, is positive for protein S deficiency, and she had one episode of deep vein thrombosis, and that was 2 years ago, and she treated it with warfarin for a year. She has acute sinus problems, and it was a year ago. She also had orthopedic surgery at the age of 7 for leg trauma. 10 months ago, she had her ovarian cyst removed. Her father has hypertension. She has no family history of venous thrombolism. Her mother died of metastatic cervical cancer at age 49. Her brother is healthy. She lives with her husband and her 8-year-old daughter. Patient has a 12-pack year smoking history, and she currently smokes a pack a day. She's a business executive with an active travel schedule. Current meds she's taking oral contraceptives. She's been taking those for 4 years. She's taken amitriptyline, Cafragot for migraines, and metoclopramide, and denies taking any herbal products. She's negative for coughs. Currently is negative for extremity or neurological complaints. She has some allergies. She said Demerol makes her feel a little goofy, and the sulfur containing products is what she's allergic to as well. The physical examination was done, and the patient seemed anxious, but otherwise she was in no distress. Her vitals were normal except for her respiratory rate, which was 40, and it was labored. Her weight was normal. Her skin turgor was normal. She had no lesions. Her head, eyes, ear, nose, and throat were normal. Her neck was negative for jugular vein distension. Her cardiovascular, it was rapid but regular. She had no murmurs, gallops, or rub. Her chest and lungs, there was no wheezing or crackles. She had a subnormal diaphragmatic excursion, and her abdomen and breasts were normal. She had a She had a prominent saphenous vein visible in her left leg with multiple varicosities bilaterally. She had peripheral pulses bilaterally as well. Her feet were cool to touch. Her neurological was normal. Her labs were a little slightly high. It was the hematocrit and the hemoglobin, but that was just a little bit high. She had an electrocardiograph, and it detected a sinus tachycardia. And she had an echocardiogram, and it noted that the ventral wall movement was normal. She had a lower extremity venous duplex ultrasonography, and it detected that there was a right and left lower extremities were abnormal of venous narrowing and a prominent lateral vessels, as well as incompressibility of deep venous systems and popliteal veins, and consistent with bilateral deep venous thrombosis. Her VQ scan detected perfusion at the right base. There was a mismatch between the perfusion abnormality and the ventilation of the right lung, which makes it probable for pulmonary embolus. And currently the diagnosis for her is pulmonary thrombolism, which is basically a blood clot. And we came to this conclusion because the protein S deficiency, as well she's a frequent flyer, which can also be tight cramps, can cause that. She's currently taking birth control. With that, smoking, her history of smoking increases her risk as well. The treatment options would be to take an anticoagulant, as well as she might need ventilation and oxygen support to help with that. Thank you.